topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome to another Ask the Expert show, where we bring you the top experts for the last 16 years in the field of legal, health, financial, and home improvement. I got to tell you, we got a full house today. We found the top Medicare agency in the state of New York. We were so lucky with with Dan Alcorn and Alcorn Associates. We have got such a full show today with his guests. Let's bring on Dan Alcorn.
Thank you, Steve, for having us. Good morning from chilly upstate New York, where I think it's about 9 degrees here today, but we're excited to join you. Thanks so much for having us.
So, Ray, listen, you're such a good person. I'm not even going to tell you about our 80 degrees here in Florida, but I won't even say that to you. But hey, good morning. You brought some of your agents on with this. Would you introduce them to us?
Absolutely. So from Long Island is Alicia James, and upstate New York as well is Lai Dandles, who is calling in on audio. So we have a team of 9 from Long Island to the Canadian border. Everyone else is out in the field this morning, this Monday morning, but glad to have both Alicia and Lai join us there. We are licensed independent agents in our local communities, representing a number of, but not employees of any one company.
Dan, you've developed such a great company. Tell us about your company.
Well, as I mentioned, we are based in New York. All of us are licensed in New York. Each of us service different states beyond New York. We are independent, licensed, appointed by Medicare Advantage carriers in communities that are, a good match to our clients' doctors and medications and needs. For example, there may be a carrier in the upstate area near Canada that is, closely aligned with hospital and provider networks there, completely different than the carriers that Alicia works with in Metro New York and Long Island. So we believe healthcare is local. And so having a local independent agent aware of what's going on in the local community with regard to carriers and provider networks is really crucial to helping individuals find a plan that will get them through the next year. The annual enrollment period for 2026 concluded last week on December 7th. And so there were 1 million people, Steve, nationwide. Wow. Nationwide, there were 1 million people that were enrolled in Medicare Advantage plans that are being discontinued, 16 days from now. And so we, as a group, assisted hundreds of individuals in finding something for them for the next year. There are some, though, that did not make a decision by December 7th. And so, part of our topic today is to discuss how we can help them.
Yeah, that's pretty. I'm on the Advantage plan, and it's pretty scary when you hear about big companies who are discontinuing certain counties. It's a little scary. I mean, we're so uneducated. That's why we have a show like this. And there's so many questions. And I mean, what are some of the big questions that people have for you now after the enrollment period's over?
Well, Alicia, you want to grab that one? Like, what did I do?
Hi, how are you? Well, we're recovering from 6 inches of snow, so I don't,
Oh,
I don't want to hear about 80 degrees. Definitely.
okay.
But funnily enough, after this show, I am going to see someone who is in the category that Dan talked about, who actually their plan was discontinued as of December 31st, and you know. We were looking around because she's like, this happens every year. And so I think the biggest question that I don't know what you guys get is this going to happen to me next year? Is it going to, so I always tell them, every year is a different story and we don't know, we don't know until we know. But in a way, it kind of gives, it's a pain to change, but I say, it's really as much as you can control, it's sort of giving you control. It's time to take a look so you don't get stuck in one spot, and decide, is this really the best for me or not? So, there is a chance for this person because we didn't decide by Sunday, this past Sunday, the 7th. She gets, and not just she, but everyone else who didn't do that, who has a plan discontinued, they get until February to decide and find what is the right plan. Because I think that's the biggest question. What is the right plan for me? And do I have to do this again? So,
Right.
Right. And as Alicia said, the individuals who are enrolled in those plans that are being eliminated have until February 28th. But that means also is that come January 1, they may not have drug coverage. So
Right.
what we're encouraging folks to do, she's absolutely right, is yes, you have until February 28th, but do you really want to wait that long? We're advising folks, the annual enrollment period began October 15th. Try to make a decision based with, on the local advice by this week so that the plan you choose in your community at least has a couple of weeks to get your get your enrollment processed and get a new ID card in your hands, because when you go to the pharmacy on January 2, we want to make sure you have that coverage. So Alicia said the compliant thing. You have until February 28th. We're saying, come on, let's get this done.
that's why we're
That's right.
get in before Christmas.
I've got to say this about you agents. I had the worst agent when I first started Medicare a couple of years ago. And I didn't know, because what you don't know, you don't know. But there is so much work that you all do that people don't realize. It's almost like putting a puzzle together. Everybody is different. But the reason I bring this up is having the right agent. It is so important, because I had a lazy agent who just basically turned out as a good company, but just threw one company out. And you represent a lot of different companies, right?
We do, Steve. Thanks for bringing that up. We are contracted with a number of companies, but then we feature companies and plans in an area that are closely matched to the provider networks in that area. For example, we may, which is, alphabetically, let's say Aetna and Anthem and Humana and United Healthcare. Well, because we work in many different states, one of those companies may be strong, let's just say in Florida, but that company may or may not have a contract with the local hospitals and provider network in Alicia's community or Lai's community or upstate New York. So we try to, to your point, the work is we look and make sure that these plans in the community that we're representing works with the providers and the doctors, at least for the foreseeable future. To Alicia's point, next year, it could all be done again. The annual enrollment period for 2027, we're looking at that now. We're saying, okay, come September of this year, how are we going to prepare for this again? I want to add just one thing that Alicia mentioned, and Lai too, in a couple of counties that he mentioned, that he works with, these carriers haven't just eliminated plans, they've exited the whole region. There are areas in upstate New York and in upstate Vermont where there are no Medicare Advantage plans available. So there's a lot of disruption going on. So these million people that we talked about that are enrolling in new plans for January, it's an uncomfortable transition for them. But the first 3 months, January 1st through March 31st, there's something called the Medicare Advantage open enrollment period. And that's where individuals are enrolled in a plan. And let's just say, you know what, this isn't working for them. They're not as comfortable with it. So there's an opportunity in the first 3 months for these individuals to change their plan once again. And in New York State, Steve, there's something called a State Pharmaceutical Assistance Program, New York EPIC, EPIC. So we work with EPIC members from April through December to actually help them change their plan. So we want to let everyone know you're not married to this plan forever. If it's a Medicare Advantage plan, federal law says you could change it in the first 3 months, and in New York State until the end of the year of 2026. So there's a lot of flexibility. And again, we say healthcare is local, and to be informed is to be empowered. And that's why we represent the communities, Alicia in Long Island, Lai in upstate, to know what's going on.
We got so many calls. I don't know why they call us, but we got so many calls. People were so upset about these national commercials, and they paint a pretty picture for you. But when it's different sometimes by county, I don't see how they can do a national commercial, because a lot of them were saying what they're promising on TV and what we actually are getting are two different things.
Exactly.
So you got to be real careful when you listen to these national commercials.
Right. They'll say, call us today to see if you are eligible for a plan that may be available in your zip code. And when you call them, you're not. But now they have your phone number and your ID as a permission to call for the next 90 days. And some of our seniors tell us, I called this 800 number and now the calls just keep coming and coming and coming. And there's a lot of telemarketers out there who are not aware of what's happening in the local community. Alicia's on the ground. She knows exactly which doctor networks and which hospitals are in network and out of network, which contracts are coming up. That telemarketer doesn't know. And when you enroll in a plan through one of those telemarketing groups, that's your customer service number. Whereas if you work with Alicia or Lai, they are a second advocate for you within that network, within that carrier plan. And you get those calls, don't you, Alicia?
Yes, I do.
Yeah. Where's my card?
Where's my card? Yep.
Yeah.
So I'm going to paint a picture for you. And I don't know if this happens in New York like it did here in Florida, but I got to tell you, this is why it's so important that you have a good agent like the Alcorn and Associates. I had an orthopedic surgeon who I really loved, and I want to make sure that he's in my network. And I get signed up, and it turned out that my main doctor doesn't use this orthopedic surgeon, even though Humana showed him in the network. And it was like, no, we don't send people to them. We have our own network inside of a network. And that's, showed how lazy the agent I had was. And that's why you guys do such amazing work getting people on the right plan.
Well, Lai, you're in Montgomery and Fulton County, where there's a number of plans exiting and changing. And you want to speak to that a little bit?
Yeah, absolutely. I mean, just pretty much to piggyback on what you all were saying earlier, what we have is we pretty much have an arsenal of different plans to offer clients. We find what their pressure points are. We do the extensive research to make sure that they have what they need. It's a necessity-based thing. And we focus on that. We attack that. And the basic thing is, it has to make sense for them. It has to work for them. And it has to be most feasible for them. So all those components are very, very important in the process.
And understanding that they can change that.
Absolutely.
Flexibility is so key. Yeah. Thanks, Light.
We just got a text from Albany. I just found your show. I cannot believe that there is so much information that you need to know. I am 64 years old. When should I start applying for Medicare?
Want to take that, Alicia?
Oh, sure. Well, if you are, I don't know when your birthday is, but normally the window for applying for Medicare is a 7-month window. So it's usually 3 months before your birth month, and then 3 months after. So that's the 7 months. Now, I'm not sure if your person is still working or not, but in a minimum, Part A should be applied for. And usually, if you are working, a lot of the employers require that when you become of Medicare age that you do at least take Part A.
Right.
So their way that, and sometimes people say, well, how do I apply? And the way you apply is through Social Security, actually. You can do that online at ssa.gov, or you can go to your local Social Security office if you feel so inclined. But basically, that's sort of the timing regarding applying for Medicare when you're turning 65.
One other point on that, Alicia, is that also that if you're drawing your Social Security benefit now before your 65th birthday, you will automatically receive your Medicare ID card prior to your 65th birthday. And to Alicia's point, if you're covered under an employer plan, you can opt out of Medicare. So let's say there's somebody who's employed, covered under an employer plan, and drawing their Social Security. That card would come in the mail automatically, and the individual could say, you know what, I'm good, I'm covered under my employer plan, and can opt out. If you're not drawing your Social Security, then to Alicia's point, you have to proactively apply for that if you wish. And we help folks through that all the time. We are busy with what's called T65, turning 65, every month of the year. Because, Steve, 10,000 people turn 65 every day.
Wow.
So we don't get all 10,000 of them calling us, but we do get quite a few calls on that. And apparently somebody from Albany as well. We'd be glad to help you.
Well, we've got about 2 minutes left. I want, Dan, just tell people why they should let your company handle just all the legwork that you do when it comes to Medicare.
So having a local independent agent help you through this maze does not affect your benefits, does not affect your cost, doesn't cost anything. We are here to help the carriers, frankly, educate the public as to how these plans match their doctors, their prescriptions, and their foreseeable health events, and then help them through the enrollment process and with their questions as well. We are at 518-346-2115. You can reach anyone on our team and actually schedule an appointment direct to their calendar.
Do you have a website?
www.dgalcorn.com. Thanks, Steve, for asking that.
Listen, I want you all to have a wonderful holiday, a happy new year. Your show is so important. We have an older audience, and I'm very proud of it. And we're so lucky to have someone for the New York area like Alcorn and Associates. And you got to make sure that you bring that smiling Alicia back too. Look, see, I told you.
That's why we blocked Lai's camera, right, Laia?
Yeah.
Exactly.
Definitely don't want to see my mug.
Thank you so much, Steve, for having us.
And you'll be back. Yeah, and you'll be back with us again next month.
Yes.
Thank you so much, and everybody. We're going to be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.